Hey there, this is Dr. Osar, founder of Fitness Education Seminars and developer of the Integrated Movement System. Welcome to part 3 in helping your clients solve their chronic low back tightness. So in part 1 of this video series, we talked about the importance of the neutral pelvic alignment, and that neutral pelvis is actually a slight anterior pelvic tilt, which encourages a gentle lordosis of the lumbar spine. That's where the spine is most protected, and that's the position we want our clients to spend most of their life in. Not their entire life, they have to move out of neutral, but we want our clients to be able to achieve and be able to maintain and control this alignment. Most of our clients are using a gripping strategy, so they're gripping and bracing from the abs and or gripping and bracing from the hamstrings and glutes, which is pulling them into a posterior pelvic tilt. That's why their low back gets so tight, because those low back muscles are trying to protect against that position, that prolonged position. So one of the most important things we have to do, teach them how to control neutral pelvic alignment. In the second video, we talked about how do you start to train clients to maintain and control that neutral pelvic position. So we use the cable chop pattern as one example of how we teach our clients to maintain neutral pelvic alignment and neutral alignment of the thoracopelvic canister as well in the control of their low back and pelvis. In this part 3, we're going to share with you how we start to train our clients to move away from neutral. Once our clients develop control, awareness and control of neutral, we have to teach them how to move out of it with control and alignment. So one of the patterns that we use, just one example of the patterns we use, is we'll often use rotation type patterns. So we teach clients where neutral is. We teach them how to squat in neutral, we'll teach them how to split squat, lunge, and move into and out of standing positions in relative control of neutral. Then we teach them how to rotate and maintain that neutral alignment. So for example, we'll do a ball chop pattern where we teach clients how to rotate, but at the same time we're teaching them how to keep long through their spine, maintaining that neutral pelvic alignment. Now we understand that in life, we'll move out of neutral. It's not normal biomechanics to just be neutral all the time. But we have to ensure that our clients control neutral before they learn how to move out of neutral. They already are moving out of neutral and they're compensating with how they're rotating. They're shifting their thorax off an axis. They're tilting their pelvis into a posterior tilt. They're shifting their pelvis off the correct axis. So we're teaching them how to lunge and then also rotate and then come back and control it. Lunge and then rotate and control that neutral alignment to rotate around their hip, to rotate around the neutral axis in their spine. So again, we're going to use a lunge rotation pattern, teaching them how to progress to moving out of neutral position. But remember, the concept is first teaching the concepts, teach them how to incorporate the principles of the integrated movement system: alignment, breathing, and control. Teach them how to get neutral and maintain neutral through squatting, lunging, even as they do hip hinges, bending. Then teach them how to control that and then move out of neutral with low amounts of motion or limited amounts of motion, and then to more dynamic motions. We're now having them start doing ball tosses and throws and things like that. But remember, a lot of our clients are getting tight and are remaining tight because they're not controlling neutral. They're trying to achieve too much motion, so the body's trying to protect it. That's why the low back is tight, and that's why the low back takes a beating. Teach them how to incorporate the principles of alignment, breathing, and control. Teach them how to control neutral. Teach them how to move with control out of the neutral position. And I'm going to show you the lunge chop pattern out on the gym floor next. In the next video, I'll share with you a resource to help you become an expert in helping your clients stop their chronic tightness, especially low back tightness, without stretching them, and by developing the concepts and using the principles of the integrated movement system: alignment, breathing, and control. Hope this video serves you to become an expert your clients need, want, and will seek out. We'll catch you next time at Fitness Insider.